Hello, I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society, and it gives me great pleasure to be joined today by Dr. Sharon Bober, who's a senior psychologist at the Dana-Farber Cancer Institute, and she's the founding director of the Dana-Farber Sexual Health Program, which provides consultation and personalized rehabilitation counseling for individuals and couples who face changes in sexual health during and after cancer. Thank you so much for joining us today.
It's a pleasure to be here with you.
So let's start with trying to outline some of the most common sexual health concerns or problems due to cancer or due to cancer treatment.
Well, we certainly take a biopsychosocial approach to that question, no, meaning that changes are not only physical, but are often psychological, relational, and really affect people how they think and feel about their bodies, as well as sexual function. So, thinking about common changes, I think we're all very familiar with genitourinary symptoms of menopause, and we know that certain cancer treatments either induce treatment-induced menopause very quickly, often overnight in the context of whether it's surgery or often chemotherapy, pelvic radiation, etc. But we often also know that women deal with enormous amount of change in terms of feeling a sense of integrity in their body when people go through significant body alterations and changes. Often we don't give people a lot of support or guidance ahead of time. So there's often enormous amount of both confusion and often misinformation in terms of ways that sexuality changes either during or after cancer treatment.
So I think that's so important, the anticipatory expectations in that conversation. We often hear this phrase, and I'm not really sure that I know what it means, sexual recovery after cancer. What does that phrase actually mean?
The reason I think about the phrase sexual recovery is because, first of all, I think it implies the concept of a process, right? It is often the case that sexuality and sexual health is not the same on the other side of changes that are permanent. So I think it's important to recognize that one, recovery is a process. It's not something that is often binary, and that you didn't have yesterday and today you're fine, but that it really implies that we need to think about, first of all of the very different pieces that may be sort of disrupted or out of place for patients. Again, not just about how do I address symptoms, but how do I also help people have a sense of wholeness or integrity in the sense of self on the other side of profound changes, often in body, physical changes, as well as often relational changes. So, recovery in that sense really means that it's a process of getting back to a place where people feel whole, where people feel a sense of competence in terms of being able to manage symptoms. And there's also a rehabilitation piece to that as well, right? Again, whether that's changes in pelvic floor, changes in GSM in terms of, how do I manage symptoms, et cetera.
So I'm looking at this from a primary care lens. Often the diagnosis starts with us, and then women are then referred to oncology centers. But our experience has generally been that the focus usually is on the diagnosis, the treatment, the management, getting women through all of this. And often there is no talk whatsoever from a healthcare provider, be it from the primary care setting or in the specialty setting when you're looking at oncology and treatment, about sexual health. So, firstly, as providers, what should we be aware of and how should we be initiating this and integrating this? Because often when we give a devastating diagnosis, it's not top of mind for either the provider or the patient.
Sure. So first of all, and I think, I know to some degree I'm speaking to the choir here. Sexual function and sexual health is not part of the typical review of systems in an oncology setting. So, that may be different in a primary care setting. I think that's probably quite variable. But in the context specifically of cancer and cancer treatment, we often think that the most important thing is saving lives. So that's, the sort of supportive issues, let's call it that, are not often even on the list when we're thinking about a short amount of time and what are the most urgent or pressing issues. But the fact is, especially when people go through and finish sort of active treatment and are getting back to some semblance of normal day-to-day life, you can bet that for most patients and survivors, Sexuality is part of quality of life that's on their mind. What's interesting is that because sexuality is typically never talked about in the context of treatment, patients often don't even recognize that certain symptoms are even due to their treatment, for example. Often we see women who are suffering from urinary symptoms having no idea that that had something to do with that sudden estrogen deprivation, because they're on a drug in the context of risk reducing chemo prevention, right, for breast cancer. So I think for providers, the first question really is a sort of a ubiquity statement acknowledging that sexual health is often disrupted in the context of cancer treatment, and really asking that patient if there's anything different or distressing that they want to talk about. And then I also think, again, it's not just about managing function. So I would, as I always say to my patients, clearly that is primary in terms of where you need to start. But what I'm often struck by is that women are given information, for example, about vaginal dryness, because that's something that we talk about more often these days, but that's all they hear. And that is often not enough to help people put the pieces back together again in terms of figuring out how to talk with partners, how to deal with other pelvic dysfunction, how to be able to feel that they know where to start when it may be months or even years since they've been sexually active.
It's interesting because when we think about GSM in general and women who don't have cancer on top of it, this is often a conversation that isn't initiated. Women don't understand the natural progression. And we know that there's couple impact, but we often don't think about the partner. So how can we open up this conversation, and when do you think is appropriate? Is it appropriate after treatment is finished, during treatment, when we're initiating treatment?
It's a great question, and people always ask. And what I always say is that it obviously can't be, the first day you hear that you have cancer, because I understand there's too much going on. But when you wait 2 to 5 years into survivorship mode, it's way too long.
Right.
So I would say, again, if we think about normalizing this in the context of review of systems, the way we ask about nausea, the way we ask about fatigue or sleep, really from the beginning to say that, we know that sexual function or sexual health often gets impacted. How's it going? And it's just in a more routine way, then people are going to be able to express what their needs are when it's relevant for them. And I say that because I don't think it is relevant for everyone during the same time frame. There are many patients who will say, I couldn't hear this when I was in the middle of active treatment. I had other things to think about. So I think that if we sort of think about it in a more routine way over time, patients will also give us feedback as to when it is that they need help or they feel like they need some support.
So if you are part of the team that's treating or part of the support group that has diagnosed and now the patient is moving through the system, and you don't necessarily feel equipped, or your cancer setting isn't necessarily equipped with a multi-team approach that can help you deal with it, are there specific resources that we can direct patients to, or certain settings that they can look at to have information in general?
Absolutely. And what I would say is heartening for me is that in the years that I've been doing this work, when I look at the resources that are available, particularly now online, even in the last, let's say, 10 or 15 years, there's a lot more available for patients. So certainly when you look at the NAMS website, when you look at the ISSWSH website, when you look at the National Cancer Society, the ACS, there are an abundance of links and resources to really sort of help women get a very clear, sort of, I would say, fundamental sense of which are the ways that sexual function gets commonly disrupted, and also some of the common pathways for next steps. And again, I think that from my point of view, we need to go beyond only talking about vaginal dryness, and we need to help women really think about this, I would say, in a whole person sort of way. This is to say, often with a couple, for example, it's a great example you brought up before. When a couple has been, I would say, has sort of had this dynamic disrupted so that they are they're no longer sexually active, but more importantly, there's a role change, right? All of a sudden your lover has been a patient. All of a sudden you've been a caregiver, not a lover. Or they're really worried about hurting each other. For example, if a partner's thinking, I don't want to hurt you, so I'm going to sort of stay back. And a survivor feels like, well, obviously they're not attracted to me anymore because they won't approach. there becomes a whole different dynamic in the relationship that is really powerful. And often nobody even understands that piece, except for each partner is just feeling a sense of rejection and disappointment. So I think people really need to understand, and we can give our patients that perspective that this really affects a whole person. And so it's reasonable to sort of scan that landscape in a more holistic way to figure out where somebody might need some help or support.
So it's interesting because the World Health Organization defines survivorship not only as the individual who's currently being treated, but anybody else who's touched by the cancer journey. So that means your partner, in a sense, is a survivor as well. And I think that what you're pointing out for us as practitioners listening to this is the importance of holistic. And if we don't necessarily feel equipped to personally deal with this, to open up the conversation, to empower our patients, to at least direct them to understand that this is part of the puzzle that we can't ignore.
I think that's exactly right. And I would also add to that that when patients don't hear providers initiate the conversation, especially cancer survivors, the implication often is that this is I call this the high price that people have to pay for saving their lives. So although it is not the case that many of these things cannot be addressed, that silence implies for many patients that this is just the cost that I had to pay. This is part of the side effects I have to live with. And often people don't even realize that there is something that can be done.
I think one of the most important things and messages that I'm getting for you is how important it is to empower ourselves with this information and empower our patients with this information to understand that this too is part of the healing journey. Thank you so much for joining
Absolutely.
us today.
Thanks for having me.